The main questions are relate to the prognosis. So what is the expected prognosis? And that is assigned by different risk groups. The risk groups are defined by risk of relapse. And what determines the risk of relapse really comes down to two factors. One are the genetic mutations that were identified in the cell. So it's very important to understand the mutations that your child has and how that impacts their prognosis. It's also determined by response to therapy. So after the first cycle of chemotherapy, we measure response in all patients. And those patients that have no detectable leukemia at the end of one cycle of therapy have a better prognosis than those that still have detectable leukemia at the end of the first cycle. So when talking about prognosis, it's important to know the molecular or genetic mutations that occurred in your child's leukemia, and it's also important to know their response to therapy. The next thing that is always worth discussing with your doctor are the side effects that you expect to see throughout the entire course of therapy, but also with each cycle of therapy, and how side effects from the last cycle might affect your child's ability to tolerate the next cycle, and what measures will be taken to help your child get through each cycle. Lastly, as patients move through treatment and complete treatment, I think it's very important to understand what is the follow-up schedule. How frequently does your child need to be seen? What is the expected chance that the leukemia is going to come back? And when can you worry less? When can you worry less that the leukemia is going to come back? This is usually about 5 years after treatment, but I think for each patient, it's worth having that conversation specifically with the physician caring for your child.